Hey there, and welcome to We Listen and We Don't Judge. I'm Claire, a mom of 2 boys, and with me is Mikhail, mom-to-be of a sweet baby girl arriving this April. This is your go-to space for real talk, laughs, and everything in between. We're here to share the highs and lows of motherhood, friendship, and just life in general. So grab a coffee, kick back, and know that here, we listen and we don't judge. It's all love, all the time. Let's dive in.
Hey podcast listeners, in this episode we were joined by our very first special guest. Debra Lowrance is the founder of Labor of Love Midwifery. She is an experienced midwife and women's health provider in Southeastern Illinois who offers personalized prenatal, birthing, and postnatal support for home births as well as primary care for women from adolescents through the golden years. We are so thankful that Deb agreed to join us for this special episode. We learned so much and think you will too. Let's dive in.
Hi everyone, and welcome to episode 4 of We Listen and We Don't Judge. Thank you guys for joining us again. I'm Claire.
I'm Mikhail.
And we have a special guest with us today, our first guest on the podcast.
You're so special.
Welcome. This is Debra Lowrance, and she is the owner of Labor of Love Midwifery, among many other titles. So I just thought maybe we'd start with like a little introduction about if you want to introduce yourself, and then we can kind of get into your journey of what led you to where you are now.
Sure. So thank you for inviting me.
Yes.
I've just listened to a few of your podcasts already, and I'm enthralled. You're doing a great job.
Thank you.
So my name is Debra Lowrance. I am the owner of Labor of Love Midwifery in Robinson, Illinois, and I do something very unique. I do home births with parents, and it's probably, this is the best gig I've ever had in my entire life.
I love that.
So, yeah.
I love it. So we know each other from way back. She is one of my best friends, Rindy's mom, and that's how we kind of became, or got closer to through this my journey with midwifery. I talked about in a previous podcast about my experience with C-section with my firstborn, and I knew I wanted something different for my second, and so I just reached out to Deb. And she told me at our first meeting that at the time, she did not deliver at hospitals. And I just, we had such a great conversation. I adored her. And then she said that. And on the way home, I was like, well, this isn't really going to work out, because in my mind, I was so scared of the home birth thing. Because think back, this was 2018, early 2019 when we met or talked about this. And I was like, you know what? I love her so much. She was so comfortable to talk to, and you're just so reassuring, just an easy person to be around. And I was like, I'm going to stick with her through prenatal care. And so I'd go to you, you'd come to me, which also amazing service that she offers. And Deb just really started to give me so much more confidence throughout those prenatal care meetings or appointments, and educated me on, the services that she offered and the statistics. And I mean, by the end of my pregnancy, I was gung-ho, ready to deliver that baby in my home. And it was such an amazing experience. And at that time, not a lot of people were doing it. So I remember going to City Hall to get Maddox's birth certificate after he was born. And they were like, what? Wait, you delivered at home? Usually it's just Amish people that come here, And so then COVID hit, right? And that really rocketed your business. So tell us about that a little bit.
Unfortunately, COVID was not good for many businesses.
No.
However, I will have to say, there was very positive things that came to me out of COVID.
Yeah.
I had women at the last minute finding out that maybe their husbands or their moms or sisters couldn't attend births. Mm-hmm. They were frightened. They wanted that support, and so they were looking for alternatives, mm-hmm. and last minute alternatives for some of them. And it was just amazing. It was really amazing. And, once you've experienced this, mm-hmm. you never want to go back.
No.
You never want to go back.
No, I wanted to have another one. I'm like, we knew we were done, but I was like, this was so amazing. Like, maybe one more, Noah, like one more. It was such a great experience for me. And then even my husband said it was a wonderful experience for him because, you know, they're out smoking meat in the shop, and they came in after Maddox was born and brought us all lunch, and, you know, just they were playing 42 and hanging out, and it's just my favorite picture. Mikhail and I were sending pictures the other day of like kind of some to put in the podcast episodes, and
I can add some more into this one too.
One of my favorite ones was just a shot from like the corner of the room, and I'm in the birthing pool, and you're standing over me, and Jamie's sitting on a ball, you know, the bouncy ball thing, and she's like reading a book, and my mom's watching me intently, and, you know, it's just like surrounded by all of these amazing women and just such positive energy and just so relaxed. And it was beautiful, just such a beautiful experience, and highly recommend to anyone. I talked to a lady in Fairfield the other day, and she was like, I want to get together with you and have coffee. Jamie's my midwife.
Oh, great.
So I was so excited to hear that. And, you know, I know you're an hour and a half away in Robinson, but I know you cover a lot of this area, and you've expanded. So how many midwives do you have underneath you now?
So unfortunately, I don't have as many as I want. So Jamie worked with me for almost 5 years as a birth assistant and my right-hand man. And while she was going to midwifery school,
Yes.
she graduated this last year, and she is now a midwife in her own right. And so she's
Wow.
joined my practice,
Okay.
and she cares for people there too. So I have lots of birth assistants that are, I'm glad, but midwifery trainees. I've got 3 birth assistants right now that are attending midwifery school.
Awesome.
So I have found that's the best way to grow midwives is to train them from within. It's
Yes.
hard to recruit midwives. There's so few of us across the nation. And so that's the way I'm going to grow this. And my goal when I started this business was to spread midwifery all across Southern Illinois. I'm doing that in lots of different ways, but now I also need to add Southern Indiana.
Well, what a great problem to have, you know?
Yes, yeah. Oh, yeah. The business has just exploded.
That's amazing. Well, I was going to say follow her on Facebook and Instagram, but she has also been attacked by the hackers. So, but do they have a website? You have a website or a phone number?
Sure.
Or
I
something?
have a Labor of Love Midwifery website that you
Okay.
can go look at us. It needs updated. I'll work on that, or maybe I'll hire you to
Yeah.
help me. I definitely need to hire you to help me figure out the stop the hackers. But yeah, they can check me out there,
Okay.
and I can be reached at laboroflovemidwifery@outlook.com.
Okay, awesome. So a little bit about your backstory. Like, you worked in hospital settings. You started, if you want to kind of take us through that, and then what kind of inspired you to make the big leap of, because you were like heading towards retirement age when this all
Yes.
started. So kind of give us a little bit about that journey.
Sure. I started out as a nurse first, was a nurse for many years, worked mostly OB, labor and delivery, for most of my life, was actually a nurse manager in an OB unit that I loved. That was the job that I thought I would retire in. And did a little bit of everything else within that facility. I managed lots of other different aspects of that facility. And then, of course, as things happen, you have new CEOs that come in who have different ideas.
Right.
And so, unfortunately, cost cutting was high on their list at that time. And so I lost my job as a manager. They were gracious enough to let me stay on, but I found myself as a woman who had always worked 50, 60, 70 hours a week, never thought twice about it, one of those, go-getters.
Right.
And here I was working night shift, 3 12-hour nights a week, twiddling my thumbs
Yeah.
and thinking there's got to be something better out there. So that was the time that I made the leap to decide to go back to school. I had always admired all those people that had all those credentials behind their names. And I thought, I had an associate's degree at that time. I thought, I'll just go back and get at least my bachelor's.
Yeah.
in my bachelor's training, I had a great mentor who was a nurse practitioner, and she was like, Deb, you really ought to think about becoming a nurse practitioner. And I was like, oh, I don't know.
Yeah.
And she said, well, really, she said, you think about it, but she said, you really have to just make one choice, whether you want to specialize or generalize. And I was like, well, I got to specialize. I love moms and babies. That's my passion. It always has been. And she said, well, you need to be a midwife. And I was like, what? I don't even know what a midwife does. So that started my journey. I got my bachelor's, transferred to University of Illinois, did my master's in midwifery there, started a midwifery job in Decatur, Illinois, serving at a physician business practice. They were a very busy practice. They owned several clinics and delivered at 2 hospitals. While I was going there, I decided to go back and get my doctorate degree, and I also taught part-time at University of Illinois.
Wow.
So I was in that job, loved what I was doing, expanding the midwifery within that job, and part of me just started seeing some things that weren't settling well with my soul. I started seeing a lot of bullying, a lot of what I would call obstetrical violence, just things that weren't sitting well with me, a lot of horizontal violence between the physicians and the nurses and the midwives. And part of me just was like, I want to see birth in a different light.
Right.
And I didn't know what that light would be. One night when I was on call, listening to a podcast late at night, I happened on an interview with a Dr. Stuart Fishbein. Dr. Stu is a home birth physician, was a home birth physician for 10 years. Wow. Only he did home births with a twist. His were all the moms that people label as high risk. The twins, the breaches, the C-sections, prior C-sections. And he did home births and had amazing outcomes. Well, that started the light bulb. And I was like, well, I know some home birth midwives. Let me scope out what this entails.
Yeah.
So I contacted some, spent some time with them, learning about how they set things up. And laws were changing in Illinois at that time where I could apply for something called full practice authority. And that would allow me to start my own business, and I didn't need a physician.
Okay.
So that opened up a big door for me. I started that business in the end of 2018, had 3 clients right off the bat.
Yeah.
And it was amazing from the get-go. The next year, I did pretty good for my first, full year of practice. But then, like you said, COVID hit, and oh my gosh, things just kind of blew up from there. And I just love it. Honestly, I can tell you, I have learned more about birth in the last 6 years than I was taught in any part of my education and training.
Wow. That's crazy.
It is crazy.
But hands-on experience is the best experience that you can have.
Oh my gosh, it's amazing. And one of the sad things is in that, and I call it the medical model system, we breed fear into birth, anything about pregnancy. We breed fear. We breed fear into the doctors, the nurses, the patients, the hospitals.
Yes.
We breed fear. And when you step outside of that fear-based model and embrace it as something that is very natural, physiological, we're made to do this, women.
Yes.
We really are. And not only us, but our babies are made to do this.
Yes.
And so it's just a beautiful thing to watch.
Yes, it really is. And that's just something I think, I want to shout from the mountaintops, is because there was so much fear bred into me and all of us as women when it comes to pregnancy and birth, and your baby's too big. There's all of these things. And like you said, it's not just bred into the mothers, it's also bred into the doctors and the nurses and the hospitals. And so when I talk about my experience with my first, I'm not talking bad about my doctor. I loved her. She was wonderful. But their business model, their structure is just different than, what I got to experience with my second. And one thing that we've talked about a lot is just, like your birth plan. Everyone has this birth plan or this vision of how it's going to go. And every single experience is going to be so different. But having someone there advocating for you and like, these are my hard, like, this is what I want for sure to happen or not to happen. And these are my softs or whatever. Just having someone, if you don't want to do a home birth, having someone in that hospital room advocating for you when times get tough and you're ready to give up. Now, Claire, let's talk. I want to pump you back up. I mean, you just made me feel like I am woman and I can do this, you know? And if I would have had someone like that in the room with me when I was trying to deliver Felix, I think my outcome would have been a lot different.
Oh, yeah.
So
So there is great research to support having a mother-like figure in the room will improve your outcomes. And I encourage anyone that's having a hospital birth for the first or second or whatever time, hire a good doula.
Yes.
Hire a good doula. They can help you advocate, because when you're in pain or discomfort with those contractions, and if you're doing it right, you need to be in the zone.
yes.
And you can't answer questions. You can't make decisions.
Right.
You know, so you have to have that advocate there that can pull you back and go, okay, we
Yeah.
need some time to talk, and then have everyone step out of the room, and then you and the
Yes.
partner and the client talk about what is our goal here and what do we want to do.
Yes. And even like having someone there to advocate to get other people out of the room. Or, you know, when I was delivering Maddox, Deb pointed out, like when my son Felix would come in, I would flip from this focused, like I'm ready to, you know, push this baby out, to I would flip into mom mode. Hey, buddy, you know, I didn't want him to see me, you know, hurting or him be scared or, you know what I mean? There's so, in that hospital setting, there's just constant rotation of people in and out with doctors, nurses, family members, you know, that type of stuff. So just having someone there to like let you do your thing. But I don't know what order we're going in, but I was gonna ask about too, like, what's the word? I always forget. Like what induction is and what an epidural is. What do you call those? Interventions. If you wanted
Yeah.
to kind of talk about like interventions and how those can affect your outcomes as far as like natural delivery.
Sure, sure. So, you know, I think, you know, Mother Nature has it all figured out. And it's not Mother Nature for me, it's God. But,
Yeah.
you know, it's been planned, it's designed. And then if you interfere with that process, you can end up with this cascade of interventions. And when I worked in the hospital setting, again, like you mentioned before, it was kind of like we've got to hurry and get these people delivered. We need the room. Let's go, let's go,
Right.
let's go. So you were always looking for things to push it along. And sometimes when we push, we get pushback from the body. And so a lot of times the inductions where we're giving, you know, artificial oxytocin to try to bring on labor. And then that's not like normal labor. And then that pushes mom into, oh my gosh, I need an epidural. I've got to have something for this, because again, that's not normal labor.
Right.
So then you get the epidural. Well, then there's side effects from epidurals. You know, your blood pressure can fall, then baby's heart rate can fall, then that can send everybody into a panic. There's lots of different things that cascade of interventions that can occur that unfortunately often lead to a C-section.
Wow.
And so we know that we do way too many C-sections here in the United States. The average nationwide is about 35%.
Wow.
We believe that probably the normal should be somewhere around 10 to 15%.
Wow.
And we know that at least 50% of all C-sections are unnecessary. And about 50% of those lead to bad outcomes.
Wow.
What would you consider most of the time is like a necessary C-section or reasons for?
If we have, you know, significant fetal distress, if we have mom's blood pressure rising very high where it's going to possibly lead to seizure activity or bad outcomes, very, very poor controlled diabetes. There's lots of medical reasons that we may need to do a C-section, honestly. But we also are doing C-sections for all the wrong reasons. And most of the time I find when I listen to moms' stories of their previous C-sections, You know, there's always red flags when they're telling me their story. But, you know, sometimes I think we're just not patient enough. You know, we're inducing way too much.
Because we want that control of like knowing when it's going to happen and, you know, that type of thing.
Yeah, and don't get me started. There's
Yeah.
this stupid research that suggested that it might be better to induce all moms at 39 weeks to reduce the C-section rate by 3%. But if you hire a good doula, you could reduce it by 12 to 25%. So why aren't we hiring a good doula?
Yeah, right? That'd make more sense.
So there's lots of
Yeah.
reasons that kind of drive us down that path. So again, getting a good advocate. If you're doing a hospital birth, yes, get a good advocate. And I often teach classes about, you know, for hospital birthing
Yeah.
moms, about how to write a birth plan, how to get the birth of your dreams and things like that. So
Yeah, I think that's such a great thing to teach because, you know, I just, like I said, first birth, I just trusted the doctors and I just kind of went in there just not with that. I didn't really have a plan. Like, yeah, I had this like how I hoped it would go. But I immediately got hooked up to IVs. You know, there was limited mobility. I got the, where the pee thing, what's it called?
Catheter.
Got the catheter. And so it was just limited mobility, and I just sat there and was pumped full of IV fluids, and that can be hard. And like, it's not natural to deliver a baby typically, right? On your back with your legs up in stirrups.
my
like,
mom's never picked that
yeah,
position.
I mean, I think
rarely.
I was gonna say I ended up
rarely.
in that position, but
But you weren't flat. You were more in an upright position.
I was true. But yeah, instead of just laying there with your legs up and stirrups, a lot of moms I've heard is on like all fours, like they're on their hands
the
and
number one
knees.
position for moms to pick, if they're choosing, is going to be probably hands and knees or kneeling.
Yep.
Which makes
Second,
sense.
second one is standing.
Yeah,
Yeah.
it's just more primal and just comfortable.
Because
you
when you're
know?
in pain, who wants to be?
Have you ever seen a
Laying on
deer,
their
a
back.
cat, or a dog lay down on their back with their legs up in the air? Never.
Imagine a calf coming out that way. Like,
I've seen the side too. Is that true?
Yes,
Like,
sideline is a
sometimes
great
side?
position. Yes.
it's easier to like open up your hips, I would think that way. So yeah, it's just it's interesting.
Oh, this is an ironic thing. So we were always taught in that medical model, you know, the legs back
Right.
and out.
Yes.
But that actually does not give the outlet, the pelvic outlet, the opening that it needs. So if you pushed your knees closer together while you're pushing,
Really?
that opens the outlet.
I've heard that too. Yeah, that the knees being out, it like is actually
kind of
closing.
closing it.
Yes.
That makes sense. But yeah, you just, and you know, you, before you have babies too, you see all these movies and you know how they're, I'm sure they stress you out to watch. But it's like, oh, my water broke. And then like they run to the hospital and then,
And there's
you know,
all this screaming.
yes.
All this screaming, which is not normal
Not.
in the births that I attend.
No.
Moms are not doing that.
Not at all. Like my mom, I remember after or while I was delivering Maddox and then afterwards, like her saying like, that is not how I pictured this going at all. And, you know, we were pushing Maddox out. Like, you knew I was ready. Like, we were kind of pushing him along more so than she typically does. But she's like, you know, it wasn't this, like, you know, thing. But,
Did
know,
you like? I just have to know. Did you like make noises at all?
Oh, yeah, I'm sure I was, like,
Oh, there was some grunting. There's always
Yes.
grunting and primal noises, but
Yes.
there's
It's
not
never
this outright
screaming.
screaming.
Yeah.
No.
And it was a natural birth. And I think, like you said, go back to you were talking about these, you know, like getting the epidural and getting the Pitocin. That type of stuff causes a different type of labor. So your contractions are going to be stronger if you're induced, right? It's a
Yes,
different
yeah.
feeling.
You know, giving that artificial oxytocin is like from going from 0 to 60 very quickly.
Yes.
In normal labor, where your contractions start out slowly, they build over time, there are actual chemicals being released in your body to help you with pain. Your cortisols, various lots of different things are being released in your body to help you with pain and also help your baby.
Wow.
And when we override that system with artificial stuff and artificial painkillers, we unfortunately kill our natural system override our natural system. And the bad thing is we rob that baby of any ability to get any of that soothing pain relief as well.
And then that's going to make you want to get the epidural more because you're in more pain. Mine came on really fast. I think I was at an 8 by the time you got there. Like, you know, so that was like my toughest time was just right at the beginning. But then, like you said, like I really did kind of just get comfortable and was, you know, chilling in the pool. And it just, it feels good to like, when you're pushing to get that baby out. It doesn't hurt at all. And I remember.
I don't believe you.
Yeah,
I'm just kidding.
It really didn't.
I'm just
like,
kidding.
It felt good.
I'm just kidding.
I remember her grabbing or saying, "Hey, his head's coming out. This is going to be the last time he's in your body. Do you want to feel it?" And I was like, "No, I'm just ready to get him out," you know. And she's like, grabs my hand and like, feel it. Take the moment. Enjoy this. And I just think that's such a special thing to point out, too. It's just, she really, it's just such a wonderful experience. Slow down. Enjoy it. You are about to become a mom, and like,
and that's going to rock your world.
Rock your world, and like just how amazing is the female body? How amazing is it that we make these babies, carry them for 9 months,
and the placenta. We grow the placenta and the baby.
Yes, and I want to talk about the placenta. We talked about it a little bit yesterday. Just God's signs, right? Like you spread the placenta out and look at it, and it looks like the tree of life. And it's like, I compared God to Taylor Swift.
Sorry, God.
Sorry, God. Drops these little like Easter eggs or like connection things everywhere. And I just think it's the most beautiful little connection. Like, hey, you have this placenta inside you. You just grew this beautiful baby, and here's this symbol of life that's coming out after it. You know, like it's just really pretty.
That's a neat analogy. I love that.
Yeah.
For me too. Like, I mean, pregnancy has just. I feel like it's one of those things until you can think that you're the most prepared, and then until it actually happens to you, it's just, and it's like me going through it. I'm like, how can someone go through this and not believe in something?
A higher power.
Just because it's so crazy, like the things our body does and the things on my body that are changing to prepare for her, and like, it's crazy.
Yeah, there's so many natural things that happen, and it's amazing. It really is. We should be just so excited about being women.
I know, right? We should. Women are amazing. If you don't agree, then switch podcasts.
That's right.
Find a different one. No, I'm gonna backtrack to something you said, because I'll forget But you were saying how you went into it just like trusting everyone, and I feel like I didn't do that as much, just because with my prior experience this summer, like I was just nervous anyways, and I am kind of skeptical of people anyways, because I'm like, well, I'm a number, I was aware of that going into it. But I think when you're sitting in your every appointment, for me, I'm not confrontational, like I am just kind of like a nodder, you know? And it's like overwhelming. You have questions, but you can tell that they're trying to just get you in and out. You can tell that they're coming in and just ready for you to leave. My doctor doesn't know my name.
Yeah.
Do you know what I'm saying? Like so every time I almost, like my husband asks me, he's like, how do you feel? And every time I'm just like, okay, like what do you want me to say? Like there's no, I don't know. I'm just excited every time to know she's okay and to.
It's not, and the system, unfortunately, like she mentioned early on, it's not set up to care for patients.
Right.
It's all about the numbers.
It's a business.
I mean, it's a business, and honestly, they're being pushed. You have to see 20 to 40 patients a day. I was there. I used to work that.
Right.
And you have to see 20 to 40 patients a day, and we got to hurry and speed this up, and you got to get out on time and get all your charting done. And so there's no time built into the system to individualize care. Answer, educate, do all the things that I feel as a midwife are so important.
Right. Yeah.
There's, Michaela's baby is breech right now, and that was something that she's like, here's a pamphlet to do some exercises to try to help flip her.
Or
And like,
my acid reflux has been so bad. Here's some things you can take. 6 things. Like, it's just everything. Nothing's like, okay, well, when are you experiencing acid reflux? Or like,
let's get to the root of the problem.
Nothing is personable.
Let's take 15 minutes and let me help work you through some of these exercises. Or, let's try to flip the baby. Or, just.
She's frank breech, so I don't know if I'm like, are there certain ones that I should be doing since she's frank breech and not like her feet aren't down, her butt is down.
So your best thing, go to spinningbabies.com.
Yeah, that's what
check out all the breech stuff there. Do
Yeah.
all those, the inversion, the sideline release, do the jiggle. If you know someone that can teach you a rebozo, do all those things. See a good chiropractor.
Yep.
You want to find one that knows Webster's technique.
Okay.
And then moxibustion, Google it. It's some crazy Chinese method, and you'll think I'm crazy, but honestly, like 50 to 60% of the time, it works and it's non-invasive. So why wouldn't you do it?
Okay.
You know?
Yeah.
And then rather than accept the fact that they're going to want to C-section you if your baby's breech at 37, 38 weeks, ask for a version attempt with someone that's good at versions too. That's the other thing. You got to find out who's good at doing an external version. Those are all things you can try, or you can find a really confident
Midwife.
breech provider, which are very few and far in between.
Yeah. Well, that's something I wanted to talk about too, is because there are certain things with your, midwifery business that, okay, you need to go to a hospital setting to deliver this baby. I know with Maddox, it was, are you going to have gestational diabetes? I'm already a VBAC. If I had gestational diabetes on top of that, that may have been the line where I would have needed different care, correct? So if you kind of wanted to talk about, if you want to talk about
Sure. So this is what I'm finding, and I've really discovered this in the last few years, like really exploring and learning more myself, and which I think is great.
Yes.
But I honestly, last year, I think I had 3 gestational diabetics.
Yeah.
One of them was doing concurrent care with a maternal fetal medicine specialist just because she had some complicating hypertension issues.
Okay.
We were able to fully control her gestational diabetes with diet and exercise.
Wow.
And I've had 2 others that were able to do the same thing.
Wow.
Big fan of Lily Nichols. She's a registered dietitian. She has probably the best books in the world on real food for gestational diabetes, real food for pregnancy, and real food for infertility.
Wow.
And I follow her guidelines specifically, and have probably, even since I saw you, Claire, become even more sticklers about really trying these things, because I think they make a huge difference. And it's really honestly teaching us the way we should be eating
Yes.
rather than what we do.
Yes, for sure. For sure. So, that's really cool that you can still help with if you do have
Yeah.
gestational.
So,
I know you're okay with VBAC, obviously, and you have delivered breech babies as well,
Yeah,
correct?
so when I first started this business, I worked with another midwife, Dessa, if you're listening out there, Dessa.
Yes.
Yay, Dessa. But Dessa asked me at the very first interview where we were trying to decide if we were going to be a good
Right.
pair up, and she said, "Are you going to deliver breech?" And I was like, "Oh, I hadn't really thought about that, because in the hospital setting, they're all C-sections." And she
Right.
said, "Well, you're going to get some surprises." And I said, "That's right, I am going to get some surprises." Well, then I've got to get better trained on this. So I did some training right off the bat with Dr. Stuart Fishbein. I went out to Utah and spent some time with Dr. Fishbein.
Yeah.
And then I've attended Breech Without Borders trainings, and I do that pretty regularly. Shout out to that group. Oh my gosh, they're making waves across the world with how they're changing the thought about breech births. So honestly, what happened was, I think in the early 80s, pretty much every hospital quit doing breech births. They considered it a liability because of, 2000s, because the trend had already started. And then there was this research article that came out that suggested there might be worse outcomes for babies born in breech births. So all hospitals quit. The year 2000, they just quit doing breech births.
Wow.
In 2002, the authors came back out and said it was a flawed study and they had made mistakes and there really wasn't any change in outcomes. But the damage had been done.
Right.
And we had stopped teaching physicians on a regular basis how to do breech. We had just quit doing breech in hospitals. You were an automatic C-section.
Wow.
Breech Without Borders has over 40 studies that have been published since then that show that there's really no difference between outcomes with breech births. And so it's amazing to me that we have all this research, but we're not paying attention to it. And so Breech Without Borders and Dr. Stu go around the world trying to reteach breech to physicians. Unfortunately, the only people that usually show up are midwives. So there's some physicians out there. But so it's just amazing to me that we're still doing C-sections for a variation of normal.
Right.
And I'll tell you, I kind of love breech births.
Really?
They're kind of fun.
Yeah.
Because when you have this breech birth, honestly, I tell people I feel more comfortable with a breech birth than I do a head down birth because I can't see baby when they're head down. I don't know how they're really doing. I'm listening to their heart rate. I'm guessing, oh, you're doing okay because your heart rate sounds okay. But with a breech birth, when their body starts coming out, you know they're doing okay, or you know they're not. If they're not, then you get them out. You know the maneuvers to get them out, and it's quick and easy. But it's just amazing to me when you see this baby doing the things that they are supposed to do to get out. They have to make 6 turns to get out of the pelvis, whether they're head down or whether they are coming butt or feet first. They have to do maneuvers to get out of the pelvis. And there is a cute video out there. If you go out and Google breech births, you'll find it. But there's a lady that's kind of in a squatting position, and when the baby's legs emerge, you see the baby put its feet on the floor, lift its body up to deliver its head.
Oh my goodness.
It is crazy.
Wow.
It is absolutely crazy. But babies know what to do. They know what to do. And then me as a provider, I always tell people, my job is to know normal and abnormal. As long as we're normal, we honestly in a breech birth, you're hands off, and head birth too, you're hands off. But if there's not something normal, then I might need to intervene. And knowing what those interventions are important.
Yes. And I think you were really good, or you are really good about educating your patients, you know, about that. Like just giving, like you gave me so much confidence and security that at the first sign of something going wrong, if it's, you know, if it's something that could, you know, affect like or harm you or the baby, like we're going to a hospital setting. We're gonna, you know, I'm not putting you or the baby at risk. And I think that was very, you know, comforting to me. But I also think we need to point out the fact that there are risks to not only home births but also hospital births, right? I mean, there's risk no matter how you get this baby out of you or where it's at.
Yeah, and I saw bad stuff happen at the hospital when I was there, probably more so than I ever do in home birth, but I think it's all goes back to those interventions and that cascade of interventions. I just think that sometimes we just push the envelope too much. Now, granted, hospitals are great and we need them and we need those physicians. And we know that about 80 to 85% of all births are very normal and natural. It's that other 15 to 20%. Yes, we need that hospital. We need that. And if you're high risk, if you go into a pregnancy being high risk, then yes, you need to stay in that model because that's your best place. But for the other 80, 85% of people, you're normal, you're healthy. You know,
your
the
body's
risk,
meant to do this.
the risk is pretty darn low.
Yeah. I just wanted to point out, like, your 2024 stats. We were looking at these, too.
I'm glad you could get to them.
I know. I can see them. I just always love looking at these. And my mother-in-law, she still looks at them she's followed your page since, you know, Maddox was born. And she loves to look at them, too. But so they had 17 first-time moms with a 76% success rate. 24% required cesarean sections. So let's see.
This was our worst year ever, really.
Really, with the C-sections?
With the C-sections, that was very high. But I also had
4 was high.
Yeah, I think I had 4 C-sections, I think, out of the group. I can't remember exactly. You have the
Yeah,
stats
4,
in front of
yep.
you. So, yeah, that was my highest number, and I was a little disappointed. But, you know, that's the luck of the draw. It's
Were
still
they-
less
I was
than
gonna
any
say.
hospital stat.
Yes, right. That's what I was going to say. Were they, like, did they try to deliver at home and then led to a
Yeah,
C-section?
so a couple of them we just got to a point where nothing was progressing, and I give plenty of time, if that mom chooses to do that. And it's
Right.
always the mom's choice
For
when
sure.
she decides that she's ready to go into the hospital.
Mm-hmm.
In those cases where there's no other reason other than we're just not making progress.
Yeah.
And so most of them were just failure to progress, and for whatever reason, we transferred in. And then, most of the hospitals are pretty good about giving them more time. There's a couple that I thought rushed the process a little bit. I would have rather them maybe try this and then wait and see.
right.
But there are sometimes some cases where babies just get stuck.
Yep.
And that it just happens. It really does happen. And I think first-time moms, particularly, we should all be seeing pelvic floor in pregnancy. We should all be seeing chiropractors in pregnancy. There's so many things that we can do to prevent this.
Yeah.
And we just need to learn more about that and
Yes.
figure out that early on if we can.
Yep, definitely. I think so too. Let's see. So your numbers were 36 boys versus 32 girls.
That's pretty close.
It is pretty close, but so far this year, it's boys are outranking the girls
really?
by a landslide.
That's funny. Smallest baby was 5 pounds 5 ounces, and the
Was
largest
that one early?
was 9 pounds 12 ounces.
That one was a little early, like I think around 37 and some change.
Oh wow.
Yep.
Well, that's very cool. Let's see. Yeah, I think that's kind of a synopsis of the stats, but
Yeah,
so
I think if you
interesting.
look at home birth stats across the nation, I think that's just impressive, like how much better our stats are. And honestly, if you look at the research across the board, if you have a midwife any time during your prenatal care, you have better outcomes. You have a less risk of a C-section.
Wow.
You have like so much better outcomes if you have a midwife at any point during your pregnancy. I think too that when we look at safety of hospitals versus the home, there's a lot of research to support that outcomes are way better for moms, way better, because we're not doing all those interventions.
Right.
It boils down to that. The more you avoid those interventions, the better outcomes you have. And so I think if you go out and do the research, there was a great study that came out right in 2020 by the National Academy of Sciences that looked at birth settings across the United States. And they pretty much concluded midwifery care is pretty good.
Yeah.
And honestly, your outcomes are pretty good in a home or birth center setting.
wow.
Unfortunately, that hit right before COVID.
Yeah.
And it never got the press that it needed to get press from. Yeah.
Of course not. Well, I tell it to anyone that'll listen. I shout it from the mountaintop. So
She does.
And I do.
And I listen.
Yes, I do think it'll continue trending that way, just because
I think it is for sure.
this day and age, people just are more aware of, just more into homeopathic type stuff, and
They're looking for alternatives.
Yes.
They're looking for options and alternatives.
Yes.
Yep. What other questions you guys got for me?
Yes.
I was going to ask you, this is kind of backtracking, but when you were talking about delivering breech babies, do you find that it matters the breech position that they're in, or does it not matter?
No. So there's this misinformation out there about whether they're feet first or butt first. But in all honesty, like a full-term baby cannot be just straight feet first. That's not
the
possible.
head would be coming out.
That's
Yeah.
not possible.
Right.
They are going to be in a butt down. Their feet might be dangling lower than their butt in a knee to chest position, but they're not. They're still a frank breech position.
Yeah.
Okay. Because Frank Breech really scared her, just because you get on Google, right, and you start looking
Oh,
things
yeah.
up, and they're like, this is the
The
worst.
frank is actually the ideal. So there
really?
you go.
Yeah.
But I don't think her feet are always up, because sometimes I'm like, then what is that? That has to be a foot. That has to be a foot on my bladder.
Yeah. So the feet are tucked, usually like
Yeah.
in a knee to chest position, and their feet are dangling below the butt.
And
Gotcha.
she may like stretch out or
Yes.
whatever at
She's
points.
She's so
and
this whole
yeah.
time something's been over here. I swear she thinks that this is where she's coming out, this side. And she has it wrong.
That's funny. Maddox was not breech, but he was sunny side up, right? And I didn't, I had no idea about even that. So they're supposed to come face down?
They should be in a what we call a left anterior,
Okay.
occiput anterior, so
Yeah.
LOA
And
position.
he was more just belly up?
He was ready.
Yeah, he was.
She's always like hiding her face. I mean, she's always turned
She's
towards
shy
me, I
already.
guess.
yeah.
Yeah.
She does like cover her face during pictures.
Oh,
and
always. Feet and hands.
Yeah.
Her feet are by her face and her hands are by her face.
Yeah. What other questions?
Yes. Mikhail's got
Okay.
lots typed.
Yeah. So we've answered a lot of these in some ways, but what are some common misconceptions or myths about pregnancy that you encounter?
So I think that whole fear of the home birth and the safety of the home birth, and I think if you really dwell into it, you'll figure out that there's really risk no matter where, like we mentioned, and that there is some research to support that home birth is more safer for moms. There is some question about home births and babies. I'll be real honest with that. However, I think we're also looking at some flawed literature when we look at that. And you have to understand how to look at research. So the common thing that I'll hear is, and this is going to be frightening for people, but your baby is twice as likely to die in a home birth. Actually, that's true. But it goes from like 0.2% to 0.4%. So that means 99.6% of babies are good.
Right.
And the other problem with that data is that where it comes from birth certificate data. Well, we don't know whether those were planned home births. Were they accidental births? Were they births without midwives, births without doctors? Were they,
Births that they didn't want to happen. You know
yeah,
what I
there's
mean?
lots of reasons that those births could happen, and we don't have any information about that. So it's flawed data that they're using, and you have to be able to look at research with critical eyes. And I think that's part of the fear-driven stuff is a lot of times, it's real easy for a physician to say, oh, you're twice as likely to have this, or your risk is 50% more. But really, what is that risk?
Yeah.
Is it 1 in 100 or 1 in 10,000 or 1 in 100,000?
Yeah.
Then what is the real risk?
Right.
And I have to decide that risk, not you. You're not deciding that risk for me. I need to be able to decide what risk I'm willing to take.
Right.
And so I think that's the importance of really looking at research with critical eyes and really determining what are the actual numbers.
Definitely.
And those are questions to ask when you get told, oh, this is, this
Twice as likely.
whatever. Then
Yeah.
ask, what are the real numbers? Explain to me what the real numbers are. I
Yeah.
can guarantee you they'll have to go look them up themselves because they're not going to know.
Right. Well, and that's, like you said, that's so scary to hear. Oh, you're twice as likely to,
It's like a headline, but then
Yeah.
you actually need to go read the article.
Yeah,
look
Yeah.
at
yeah.
it with a critical eye and make
Definitely.
your own decision. Yeah, that's a
That's
great way to look at it. Yeah.
Oh, other myths. Oh, guys, let me just go down my list because I made a list of the myths that I wanted to ban. 39 weeks is when you should deliver your baby. Wrong. No. Most of my moms, this is crazy to me, most of my moms deliver between 40.6 weeks and 41.6.
Wow.
So do we have our gestational stuff all figured wrong?
Right.
I don't know. I mean, really, if you think about it, it's just an educated guess. Or actually a scientific wild-ass guess. Swag. So, that due date should not be a due date. It should be a due month, a
Yeah.
due period.
Yeah.
Because we know our ultrasounds can be, at best, 10 to 12 days off.
Yeah, I mean,
So-
I had 2 in 2 weeks, and they told me my baby shrunk.
Yeah.
So.
One said she was this big, and then she went to the hospital
yeah.
setting, and it was a pound
It's
smaller.
It's where they click that little X, and if they're off a fraction of a hair, it can make a huge difference.
Yeah.
So, and the big baby myth. Oh my gosh, no, because those ultrasounds are not accurate.
Yeah.
That was
not
mine.
accurate at all. So you have to understand that there's so many myths. So you don't have to be delivered at 39 weeks. Do not be delivered at 39 weeks. Say no to an induction. Go on your own. Those are my best tips for people wanting to have a hospital birth when they're wanting to do things more naturally.
Yeah.
Wait at home as long as you possibly can. Do not go until you just actually feel like you're pushing the
Yeah.
baby out.
Yes.
Honestly. You can't have a vaginal birth after a section. You know, Claire's a good example of that. We should be encouraging vaginal births after sections because we know the risk with repeat C-sections can critically hinder and like damage that mom. There's something called placenta accreta that no one talks about, but every C-section you have, that risk increases tremendously. That can become a very life-threatening situation if you develop that.
That's so crazy.
And they're not telling people,
No.
oh yeah, if we do a C-section, your risk for placenta accreta is going to rise every time you do this.
Yep.
Can you
You know.
explain what that is?
So it's where the placenta is attached wrongly in the uterus, and often because of the previous scars, it may attach over the scar or in that area, and then it invades into the uterine wall and outside of the wall of the uterus into the abdomen sometimes.
Wow.
And it can become a very life-threatening situation for moms. And no one's telling them about that. And then let alone the fact that the C-section may affect your fertility, you know, the scar tissue, all of these things can lead to all kinds of problems in the future for women. Increased mortality, morbidity with C-sections. We don't talk about all this stuff.
Yeah.
And so it's important that we try to avoid those C-sections at all costs. So avoid an induction, avoid those interventions, you know. The other thing, I think the breech babies we already talked about. You know, people have this misconception that we have really good health care in the United States, especially with moms and babies.
Oh,
they
right.
have this misconception that that's the best.
Yeah.
Well, I'm sorry to tell you, but we suck at it.
We really do.
We rank number 42 in the world
Wow.
with our maternal morbidity mortality. We're actually below Iran, I believe, if you look at the
my
map, like of
goodness. Yeah,
countries.
yeah.
We're the lowest of all industrialized countries with how we do. And we spend more dollars on healthcare than any other country in the world.
That's insane.
It is insane. And so, you know, we're not the best at this. I ask moms of little boys, think about that circumcision. It's not medically necessary, but you get pushed down that path when you're in a hospital setting. So do your research and just do lots of research. Evidence-based birth has done the research for you. All you have to do is go out there and get a hold of her handouts.
Right.
And really look at it. You know, there's lots of controversy out there, you know, about vitamin K shots, about vaccines, you know, all of these things. Educate yourself. Educate yourself to the fullest. And then you make a decision and stick to your decision. Stick to your decision. And that's where the advocacy comes in handy.
I think that's so important because the circumcision, for one, you know, like that again was like, let's talk about the breech baby research or study that was done, and then 2 years later, right, they come out and say, oh, this was flawed. Like it was almost like this marketing thing, and everyone believed it. And then even when the factual information came out, it was still, the damage had been done. And I think circumcision was that same thing. It was trending for some reason, you know, to all of a sudden get your boys circumcised. And that's just the way that it happened. And no one really knew why we were doing it. You know, Felix was circumcised in the hospital setting. When they brought him to me, I didn't have to expose myself to any of that. And then I decided to do Maddox just because Felix was, right? And that I would never do it again. I was so scarred by the whole process and the aftermath of it. And I'm like, why? Why are we doing this to our poor babies? Like just seeing the rawness and the realness of it, and what are the benefits? Right. Really, there's none. It was just a clean, you know, they said it was easier to keep clean, and that's really why this started trending this way. And it's like, so anyways, do your research on it, make your own opinion. I'm not telling you what's right or wrong, but I am telling you I would never ever do it to my boys again. It seems like a crazy thing that we're doing,
Yes.
you know.
Definitely. Do the
Awful.
research. What other questions
Let's
you got?
talk about breastfeeding, because we
Oh,
haven't
yeah.
talked about it at all.
Oh, my favorite. Because not only
Just
did God
benefits,
plan this
yeah.
magical birth,
Oh,
but he also planned how we were going to feed our children. And
beautiful.
it's just magical to me. It is absolutely magical.
Let me just say, it better work for me, because these things aren't changing like this for no reason.
she's like, she's, did your nipples grow in size? Well, I'm like, that's God getting your body ready. Like they get bigger, they change colors,
They get scary.
yes, they get scary looking. They toughen up a little bit, get a little rougher.
And every day is different.
It
Every
is.
day when I look
She's
in
like,
the mirror.
I did not appreciate these things before I got pregnant. Like now they're, you know, they just look so different. But that's another thing. Like
Oh,
women
that's-
just don't talk about how much your
No,
body
no one
Oh,
changes.
my
talks. And
guys.
you think people talk about it? They don't.
They don't.
Like, no.
Oh, yeah. Yeah.
But-
And then when your milk comes in, you'll have nothing over Dolly Parton.
I'm ready.
Yeah.
Yeah.
I've never
are
been
going to be right
and
up
then they deflate
there.
into
Yes.
I don't know.
pancakes.
Yes.
Not necessarily.
But
So, yeah, so
So just
breastfeeding.
benefits, challenges, all the things. And I'm all yours.
Okay, so a couple of tips I just always tell my moms. Right after that baby's born, you've been developing colostrum for since 20 weeks. You're going to have plenty of colostrum for that baby. You just got to get that baby to nurse, okay? And you got to nurse like crazy. So you want that important first latch to occur in that first hour, hour and a half. And do not, if you absolutely can, do not let them separate you from that baby, okay? That is so important for that baby to be skin to skin. And, you know, there's this wonderful video out there if you go Google the breast crawl. But you can see these babies when they are not interfered with. If they are laid on mom's tummies, once the cord's been cut and clamped, they will all crawl up and attach themselves to the breast, just like puppies and kitties. It is
Goosebumps.
amazing. And so not interfering with the process again.
Right.
When we whisk that baby away and wipe all that stuff off and do all these things to baby, we've interfered with the process. So you want to demand that, you know, intimate hour, hour and a half with that baby doing nothing but laying next to your breast. And usually within about 20, 30 minutes, that baby will start licking, nuzzling, you know, kind of moving their head around. And then they will start to, you know, they have reflexes. They have these natural reflexes they're born with that are going to allow them to attach to that breast.
Wow.
The biggest thing I want you to know is always make sure they're getting a good latch. And you want to watch some good videos. Dr. Jack Newman has the best videos about latch. He's probably one of the best breastfeeding gurus in the world. So find anything on Dr. Jack Newman and watch his stuff. But he will talk about good latch. And you want to get as much of the brown, so that brown has been changing during this pregnancy. It becomes darker and bigger. It's providing like a visual context for the baby because they can't see a whole lot and they're going to need contrast. And so they're looking for that contrast. So that's providing a visual. You want to get as much of that brown in their mouth as possible. And you want to make sure that they're getting that good deep latch. And you'll see that because it'll work from their jawline all the way up to their ears. You'll actually may hear them swallowing. And you just want to breastfeed like crazy. Those like breastfeed like crazy. Second milk comes in about 48 to 72 hours. You'll know. You're going to get pretty engorged probably. We would ideally like for you not to get super engorged. If you're feeding that baby like crazy, you might not get engorged. And just keep feeding that baby like crazy. That baby will settle down into a nice little routine for you. Usually practice breastfeeding very well for the first couple of weeks. Do not introduce bottles or pacifiers for the first couple of weeks. If you can avoid it, you really want to focus just on that latch and breastfeeding. And find a good lactation consultant that can help you. Someone, if you're having struggles, don't be afraid to reach out.
Yes.
And it's so funny, I had a student with me the other day. I had someone call. They were having some breastfeeding issues. they wanted me to come, and she's just asking questions. And she said, now, do you charge, or what do you do? And I said, nope, because you know what? I find the first visit, I don't have to do anything hardly at all. They just need reassurance, and they need that cheerleader. You're doing everything okay.
Yes.
I might give them a few suggestions, but honestly, I don't charge for the first visit because I know all I'm going to be is a cheerleader.
Yeah.
If they're really having problems, we're going to have subsequent visits, and then we can talk about that. But it's a very natural process. And if you approach it from that aspect, this is a natural process. We're born to do this. Our breasts are made to do this. Our bodies are made to do this. And the beautiful thing is it's a beautiful symbiosis where you will provide exactly what the baby needs. And from later research, they're really thinking that honestly, maybe the breast actually takes in some of the saliva of the baby, analyzes it, and then recreates the milk to meet what the baby needs.
Yeah, I've heard that.
That's so amazing.
It is so amazing. And the breasts can operate independently of one another. There was a great study that looked at twins and the temperature of the breast. And they found that if one twin was cold on one side, the breast would warm up unilaterally to get that baby warmer.
Wow.
Isn't that crazy?
That's
so cool.
amazing.
Yeah, it's like the way that my body has changed. It's like there's no way that this isn't what we're supposed to do.
Yeah.
Like we were definitely that's what these things were made for.
Yes,
And go in with that mindset. You know, breasts are not designed to sell Doritos and beer.
Yes.
They're designed to feed our children.
Yeah.
And that's exactly what we should be doing with them. And honestly, if you do that, you're helping your health. You
Yeah.
are going to reduce your risk for diabetes, heart disease, so many other disease factors, breast cancer, things like that. So important that we use them for what they're designed for.
I think, like you mentioned, just having that advocate for it too, or just women around you that have experienced or, you know, have breastfed and can like give you tips and tricks, or having your lactation consultant. Because I think like every breastfeeding journey is different too.
It is.
You know?
It is. And they're not all easy.
Right.
They're not all easy.
But that
There's gonna
doesn't
be
mean you need to
hiccups.
give up.
No, don't give up. Get some good help.
Yep.
Keep going.
Someone told me, it may have been you, but never quit on your hardest day. Never quit when you're frustrated. Wait until sleep on it. Wait till the next morning and think about it. And are you ready to give up now when it's going good?
Yeah.
You know? So, and I
Yeah.
think that's just such a
And
good
I've
thing
had
to.
so many amazing, and I do think it's harder as a first-time mom. It really is.
Yeah.
But I've had some
little
amazing
scared.
first-time moms that struggled maybe the first 2 to 6 weeks or, you know, a few months. But then something clicked. And then they were like, oh my God,
Yeah.
this is beautiful. It's working.
Right.
It's working. So again, I think don't give up.
Yep, don't give up. You got this, and it's such a wonderful thing. And I think pregnancy, birth, and then breastfeeding, we've talked about, it just really gets rid of your modesty. You know what I mean? You see your body in a different light that you hadn't seen it before. It's not this sexual thing. It's this is literally what my body was born to do. And I think that's something to point out too, just the trend of like nursing. Breastfeeding was out for a while. The poor people did it, right? It was only the poor people that did it. And now it's like, you know, people.
I don't know if it's like, I still feel like it's
I mean, fed is best, definitely.
I've had people tell me, like, because, you know, where
Yeah.
I it's something that I really, really want, and to just exclusively breastfeed. And I've had people tell me, well, she won't have a connection with anyone else. And I look at him,
so wrong.
I look at him and I'm like, good.
But that's okay.
Yeah.
And you know what? In the research, breastfed babies are more independent at a certain age
Really?
than other babies. Yeah. And IQ-wise, they're way far ahead of
Yeah,
other babies.
I
So-
was just breastfed and I'm just so smart. My mom
So-
exclusively breastfed all three of us.
I want to brag on one of my young students that I have right now. Bless her heart. She was a teenage mom.
Oh, wow.
And she was wanting to breastfeed. She just, that was natural for her to do that. And she breastfed her little one for 3 years.
Wow.
As a teenager.
As a
Wow.
teenager.
Go her. That's
Yeah.
amazing. I did
And
it as
now-
a 32-year-old for 3 years, and there were like times I wanted to give up. That is so
but
amazing.
I think it is so amazing. And she,
Good.
finished her high school years,
Yeah.
and now she's decided she wants to be a midwife.
That's
How
awesome. What a story.
Yes. One other thing I wanted to ask too, because we're getting close to our time, but
I know I do still have some more questions.
oh, do you? Well, you go ahead. You
No,
ask
you
some
go-
questions.
you
I was
go
just going to ask
first.
like your favorite funniest story. I know you shared some funny stories with me through your OB delivery
gosh.
midwifery. Are there any you can share that are not like
I need
HIPAA
something
violations?
I need
but-
something lighthearted right now
Yes,
'cause
exactly.
everything feels
Well,
heavy. Yeah.
Oh my gosh. My most embarrassing time of any time. In the hospital setting, of course. They're on their backs with their feet up in the stirrups. The doctor's at the end of the
Oh,
bed.
gosh.
We literally have we call it a lasagna pan. It's really that, like one of those giant lasagna pans that catch all the stuff from birth. And so I had came in to the delivery. I wasn't the delivery nurse or anything, but I was just helping clean up. And I swooped in at the bottom of the bed, and I leaned forward to pick up the lasagna pan. I slipped in some muck on the floor. And both my hands are on the pan. I slip forward and I fall face first into a woman's crotch that's just given birth. And I'm looking up over at her and her husband. Her husband has the most disgusted look on his face. He has a washcloth in his hand and he goes, "I think you're going to need this." I was mortified.
I thought you were going to say you
Absolutely.
fell into the pan, but it wasn't even her pan,
it's
it was her
worse.
crotch.
It's worse. And the mom was so funny. I mean, she just looked up at me and she goes, "Well, you could have asked me to dinner first." But that was, yeah.
Oh
That's
my
the story I was
goodness.
thinking of.
Oh my gosh, yeah. It still
laugh.
makes me get red thinking about it. And yeah, and believe me, it was really, really even worse than that because that gentleman at the bedside happened to be my husband's boss at the time.
Oh.
And yeah, so it was
It just keeps getting
it
worse.
just keeps getting worse. So we were the brunt of many
Many jokes.
over the years.
Oh my goodness.
That
That
is
is
so
good.
good.
That is so good.
Did you buy her dinner?
I'm sure I've bought many dinners at her place that she owns.
That is so funny. Okay. So yeah, these questions are literally just for me. I'm just kidding.
Go ahead.
How do you help new parents navigate the early days with their baby, especially in terms of breastfeeding and sleep?
Okay, so mom needs to be in bed for at least the first week, around the bed for another week, and then outside of there for another week. So don't go anywhere, don't do anything. In many other cultures, they honor the 40 days afterwards. And I think that's where we fail in the United States. We don't make that a sacred time for mom to get waited on hand and foot. Our Amish moms, they've got it figured out because they will have a woman come into the home for at least 6 weeks, and she does nothing but cook, clean, and care for them.
You're gonna be my
Your Amish lady.
yeah.
But
So for 40 days,
seriously.
you're gonna
Seriously. And I feel like it's just the trend to like everyone wants to come by and see the baby, and it's like come by and cook or clean or do
Give
something.
them chores to do. Give them
Let
chores
me-
to
yes.
do. Do a meal train. But I always, tongue in cheek, if you're going to have a meal train, give them specific things you like to eat because one can only eat so many
many.
spaghetti dinners.
Or
Okay,
pizza,
like
yeah.
spaghetti
Yeah.
casseroles.
Yeah.
So, and you want good, healthy food too.
Right.
You
Yeah,
want
nourish
protein,
yourself.
nourishing things.
Yeah.
So give them a list of things that you're like. Or meal prep ahead of time.
Yeah.
And make sure you put easy instructions that your husband can pop it in the
Right.
microwave or
Yeah.
the oven and do.
Yeah.
Try to just prepare yourself for doing nothing
Yeah.
for a while, honestly. And, you know,
best.
and my mom's look at me like I'm crazy when I said, no, I really just want you like in and around the bed and have people wait on you hand and foot. Another thing, and this is going to be controversial. Sorry, guys. I'm breaking my silence here.
I love it.
I'm ready.
I am sorry. Co-sleep, co-sleep, co-sleep. That is the easiest thing, and they're going to tell you all these horror stories of things that you should not be doing. But honestly, if you really want this downright truth about it, go check out Dr. James McKenna. He's got lots of YouTubes and blogs and podcasts out there. but he is the world's authority on breast sleeping with your child and breastfeeding, and it will save your life. It will save your life. Also, baby wearing will save your life. Learn to baby wear.
I completely agree. Mine were both nurse babies, and I mean, my arms are still their comfort. You know, Felix has a favorite. When he nursed, he was always on, this arm, and we slept in chairs, we slept in bed, like we just co-slept together. And then when Maddox came in, he was on the other arm, on the other breast, and that's still their comfort, and it made it so much easier for me as a mom too, instead of getting up, going and grabbing them out of the crib and rocking them and putting them back to sleep, and I almost think it's more dangerous. Okay, now I'm sitting up in a rocking chair, I'm deliriously tired,
Right.
and then imagine if I fall asleep with
Right,
the baby in my
right,
arm and
right.
you drop him or whatever. So I mean, like I said, nothing comes without risk. There are risks of co-sleeping 100%, but as a mom, I became such a light sleeper too, right?
Yes.
Like your
moms
instincts
naturally protect their
Yes,
babies.
yes.
They have lots and lots of videos where we form this protective nest around our baby while we sleep
Yes.
to protect them. I don't want them co-sleeping with other people,
That's what I was gonna say.
but with a mom, it is A-okay.
Yes.
It is A-okay. Just do it safely and learn what those
Right.
safety restraints are.
Yeah,
But
research.
yeah, so co-sleeping, it gets a bad rap, but honestly, guys, that is so important, and it's so important for babies. And literally, the bad rap comes with reducing sudden infant death syndrome. There's never been a mom that ever smothered her baby
Right.
when she was not doing drugs or smoking or doing other things. Okay, in a normal, natural environment, that mom is protective of her baby.
Yep.
And there's just lots of research out there to support it. But check out Dr. James McKenna. He's the world's leading authority.
Awesome. Yeah, definitely look that up. And we'll try to put these links in
Yeah,
our blogs too.
For
or in
sure.
our
At the
podcast.
end, or yeah.
That way you guys can easily access those because there's just so much information
Oh my
out there.
gosh,
So
there's so much. And honestly, like even when I came to this world, I call it the home birth world, I didn't have a clue. I
Yeah.
didn't have a clue until I got into the world. And there's a whole nother world out here
Right.
of people that are doing the fringe stuff, but doing it in a wonderful way, a wonderful manner, and embracing what our bodies are capable of, making it fear-free birth. And,
Yes.
it's just amazing to see what's out here once you get out of that medical mindset.
yes, I think that's, such a big part of it is just changing everyone's mindset that to not be fearful
Yeah.
of pregnancy and birth, but to embrace it. And,
Yes.
We are women. We can do it.
We can.
I have one
We
more
are.
if we have time.
Yes.
So, to end on, what advice would you give to a woman who feels uncertain or intimidated by the idea of giving birth outside of a hospital setting?
Good one. Because I tell moms, not every mom is made for home birth. You do have to let go of that fear. You have to let go of that fear and be ready to embrace something new and different. And so for some of my moms, they can't do that. Maybe not their first birth, maybe not even their second birth, but then they begin learning more and researching more. And then they're like, I think I can do this.
Yeah.
So the home birth may not be for everybody. And again, for very high risk women, then no, that you do need that hospital setting. But if you're low risk and not a lot of other conditions, just be open-minded, I think, and just, think about what it is you desire out of this birth and how are you best going to obtain that, and where is that setting going to be for you. And it needs to be a setting because we're mammals.
Yeah.
We are designed to give birth like mammals do: quiet, dark, uninterrupted spaces. And if we interfere with that process, it's not going to be an easy process.
Right.
So, but if you're fearful, you're not going to give birth. So if you're fearful of the home birth, we're not going to succeed. You need to be where you're going to feel the safest.
Right.
Where you're going to feel the most supported. And for the first-time moms, sometimes that is a hospital. But I have a lot of first-time moms that embrace this whole idea.
I love it.
And jump into it. And sometimes it's, because of, because circumstances change. Like I have one gal right now that's reached out to me that is kind of in your situation, a breech baby, and they're already pushing a C-section, and she's like, I don't want it. And she's educated herself, and she's like, we're going to try this. So, it's kind of last minute, but we're going to try it. So,
wow, that's exciting. Well, keep us posted on that.
I will. I will.
And thank you so much for coming today. It's been like just wonderful to sit and chat with you again.
I
It's
know,
been
I
a long
love-
time, I
it
feel
is.
like.
Yep, and nice to meet you, Michaela.
Yes, nice to meet you. This has been great.
Good. See, you were nervous. It was going to be overwhelming.
But it is. But everything is right now.
I
to me.
know. It's
I
your first time
know.
mom, and it is. It's
I'm
just
only
so
21
much.
too. I'm
Yes,
just a
just a
baby.
baby.
I'm just
Yeah.
a baby having a baby.
Yeah, and
Yeah.
I had this conversation with a father this week where he was talking about, their first birth and how overwhelming
Yeah.
all the information is, and how you don't get time to ask questions, and you don't, just the situations, and that you're put in,
Yeah.
and how, just as you get older and wiser, you start kind of
Yeah.
figuring it out.
And gain that confidence.
Oh,
I
yes.
think with your first, a lot of people are just really anxious and don't trust themselves. And so as you have more pregnancies and births, and you're like, wait, maybe I can do this.
There's a great book written by Dr. Rebecca Decker about babies are not pizzas. Very easy
Yes.
read, very easy read. But in her story, she went through her first birth just wanting to be that perfect patient
Yep.
and do everything they asked her to do. And she did it all. And then afterwards, she started questioning, why? Why would they not let me eat and drink? Why would they not let me move? Why would they make me do this? Make me... And she started the research. And
Yep.
that's how evidence-based birth was born.
Isn't the tagline like babies are born, not delivered, or
Yes.
something like
Yes.
that? They're not pizzas, right? They're just they're born. They can do
Yeah.
it themselves. We can
And
do it ourselves.
I always love to go talk to students, and I always ask, "What is a midwife?" And they all go, "You deliver babies," and I'm going, "No, I don't. Only mamas and babies deliver
Yes,
babies.
right.
Not me, not
Yeah.
a doctor, nobody. We're just there to observe."
That's so cool. Well, we so appreciate you coming, and we'll put all the links here so you guys can check out Labor of Life Midwifery online.
Labor of Love.
Labor of Love. She did it earlier, and now I did it. Labor of
We
Love.
had it written down wrong.
Midwifery.com.
So when I was reading it, I read it wrong.
we had it wrote down wrong, or you had it wrote down.
I'm pretty sure that Claire
It was
is the
me.
one who wrote this first topic. So
It was me.
I
Labor of Love.
follow you and read all your stuff. So
know.
I know that I knew the name.
That is so
Now
funny
you
that
guys
I
have
did
to
it
help me
too.
get my Instagram
I
and
know.
Facebook set up.
Seriously, we're
Yeah.
gonna have to help you out, but.
Yeah.
Well, thank you all for joining us on episode 4. We will be back in 2 weeks with episode 5 with Rindy Bierman.
Yes.
Yeah. So thank you again for
Thank
joining us, and
you.
we'll see you in 2 weeks. Have a great day.
Bye.
Thank you.